All right, we are going to begin. Bismillah ar-Rahman ar-Rahim. Assalamu alaikum. Good afternoon, everyone. Thank you so much for joining today's webinar on Maryland Public Health and Community Updates on COVID. My name is Zainab Chaudhry. I'm the Director for CAIR's office in Maryland, and we want to thank you all for tuning in, especially because on this Monday afternoon, you could have been doing practically anything else. Well, maybe not anything, we are in a lockdown, but many other things, and you chose to be here today with us. So we're so glad to have you with us as we talk about some very critical pieces of the conversation as it pertains to this pandemic. As you may know, the Council on American Islamic Relations is America's largest Muslim civil rights and advocacy organization. We have our headquarters based in Washington, D.C., with about 30 or so offices in about 20 or so states around the country. Today, we're going to be discussing recent updates on how the state of Maryland is addressing the pandemic, its impact on vulnerable populations in our state and on educational institutions, and how the government's going to make that critical decision of reopening the state, this and many other issues. I'll be co-hosting this afternoon's discussion along with Iman Imran, who is joining us from College Park. Iman, how are you doing today?
I'm doing well, thank you. My name is Iman Imran, and I am a legislative intern with the CAIR Maryland office, and I've been interning with them since January of this year. And because of the pandemic, a lot of projects that we were working on had to kind of be pushed to the side as we focus on this. So I'm just gonna share, the most recent statistics that were posted this morning of how many cases and deaths there are in the state of Maryland. So we have 13,684 confirmed cases, and we have 516 confirmed deaths in the state.
That's a staggering number. And I think especially considering the fact that as of April 14th, COVID surpassed heart disease and cancer to become the leading cause of death in the United States. And when we think about the impact that this has had on the healthcare system, on government agencies, and especially on individuals and families, it's absolutely gut-wrenching to see how this is manifested. And even as the epicenter of the pandemic in the United States in New York, we're seeing that the pandemic has finally sort of seemed to have peaked, and Governor Cuomo was saying yesterday that they're starting to see an improvement in the number of cases, like a reduction in the number of cases that they're seeing. We saw over the weekend that in many parts around the state and around the country, the numbers are still continuing to climb. And over the weekend, we saw protesters come out in Maryland. Mr. McAdams, we were just talking about this a little while ago. Protesters came out in Maryland and Annapolis, in Michigan and other states around the country, talking about the fact that they wanted their governors to reopen the state for business. And so with us here today, we're so excited to have our two guest panelists, Mr. Stephen McAdams and Dr. Adnan Hyder, to unpack this issue and many others. And Iman, why don't you begin by introducing Mr. McAdams?
So first, Mr. Stephen McAdams. He served as the Executive Director of the Governor's Office of Community Initiatives since January 2015. He served on then Governor-elect Larry Hogan's transition team, and he was born in Maryland, born and raised in Maryland, went to High Point High School. He's a real local, and he joins us from the Governor's Office today.
Great. Thank you so much, Steve, for being here, because I know especially with the governor's office being so overwhelmed with the number of tasks and responsibilities you have, I know you've taken time out of your very busy schedule, so we're delighted to have you with us. And our other guest panelist is Dr. Adnan Hyder, who serves as a Senior Associate Dean for Research and Professor of Global Health at the Milken Institute School of Public Health at George Washington University. For over 20 years, Dr. Hyder has worked to improve global health in low and middle income countries across Africa, Asia, Latin America, and the Middle East. He has pioneered empirical work around health systems, ethics, non-communicable diseases, and injuries. He also serves as a founding director of the Center for Commercial Determinants of Health at the George Washington University. Dr. Hyder has co-authored over 340 scientific peer-reviewed papers and numerous world reports with organizations like the World Bank and the World Health Organization and UNICEF. Previously, Dr. Hyder served as the Associate Chair of International Health and Director of Health Systems at the Johns Hopkins Bloomberg School of Public Health. He also served as the Associate Director for Global Programs at the Johns Hopkins Berman Institute of Bioethics and has been the founding director of the Johns Hopkins International Injury Research Unit. Dr. Hyder received his medical degree from the Aga Khan University in Pakistan, and he obtained his master's in public health and PhD in public health from Johns Hopkins University. It's quite a resume you have there, Dr. Hyder. It's great to have you here with us. Thank you again, both of you, for being here with us. So we will jump right into the questions. Mr. McAdams, if you can begin by maybe providing us with an update on what the impact of the pandemic has been in the state of Maryland and what Maryland's doing to respond to this.
Yeah, first, thank you very much, Zainab and Dr. Hyder, and everybody that's on the Zoom call today. I want to, the governor first wants to say thank you, because our single biggest and best weapon that we have is the social distancing, which we have been doing. Marylanders have been so supportive and doing such a great job that, in general, we are holding the curve down. It's still going up, but it's not going up at the rate it would have done if we had not done the social distancing and everybody had participated. But in general, the pandemic and the virus and where we're at right now is really having a varying effect across the state. Some areas are hit much harder, like Central Maryland. Counties are hit harder with the number of cases. It's affecting the eastern and the western shore as well as the southern shore. And in addition to those who are getting the virus or having to be hospitalized or in ICU, or for those of the families that even had someone passed away, there's just as devastating effects going on economically for folks across the state. So it's really a bad situation for everybody across the state, and the governor really appreciates the people's spirits and the people's willingness to do and use our best tool, if you will, which is social distancing. And we know it's tough being at your home, kids at home, not being able to go to school, life being disrupted. But again, we cannot thank you enough for all that our citizens in this great state are doing.
We wanted to especially acknowledge Governor Hogan and Delegate Nick Mosby and all the other state lawmakers who have helped to make sure that state agencies are providing racial breakdown of COVID-19 cases and deaths in the state of Maryland. Obviously, we know that the racial disparity in the number of cases and the location of where these cases are coming from around the country have been staggering and very eye-opening. They've really helped to expose the disconnect between how disenfranchised communities have been impacted by this pandemic. Dr. Hyder, you have done extensive work on this issue in terms of the disproportionate impact of this pandemic on communities of color and disenfranchised communities. Can you talk a little bit about your research, what your findings are, and what you've seen around the state and around the country?
Sure. First of all, thank you very much. First to the Council on American Islamic Relations and to you, Zainab, personally for inviting me. And thank you, Steve, for representing the governor's office. Governor Hogan provides not only leadership here in Maryland, but also across the country and is a very key member, I feel, of our country's leadership fighting COVID-19. And a warm salaam alaikum to all my Muslim brothers and sisters who might be tuning in. I think that what we have found, that even though this virus affects everyone, from prime ministers to those who may not even have a home to live in, unfortunately, it also exposes major structural inequities that exist in our society. And so once again, like with many other disease conditions, what we find is that the people who are often disproportionately affected are those who are powerless, those who are poor, those who are homeless, those who are vulnerable, and therefore they can be defined by either socioeconomic means, they can be defined by racial and ethnic means, and certainly also represent the minority and immigrant communities to this country. As Steve may well know, thankfully, Maryland is reporting now disaggregated numbers by race and ethnicity, as well as by age and gender. The CDC has started reporting that. At the national level, when I checked this morning, there were about 30 to 32% of cases that were being reported and deaths being represented by African-American community, for example. Here, about 40% of deaths in Maryland are being attributed to African-American communities. And as Steve knows, that overall in Maryland, if you look at the total population, about 30% of the population by self-selection represents themselves as African-Americans. So in other words, the proportion of impact is higher than the proportion in the population. So this is really important, and I know it's very close to both Steve's office, which is on community initiatives, but also to other offices in Maryland. Zainab, I think this is really important for us to, again, recognize that in fact, it is the same people who get affected repeatedly by different disease conditions that are also currently affected. And so as a community, as a Maryland society, and as those of us who care about humanity in general, it is incredibly important for us to look after those who might be more vulnerable. And we've explained that in a number of places. And I'm so happy that the call for disaggregated data has been made, because without data, without evidence, and without science, we are not going to win this particular disease.
That's an incredible point, Dr. Hyder. That really, the fact that we need that data in order to be able to determine what the hardest hit communities are and the hardest hit areas is such a critical point.
And I can add a little bit to that, if you don't mind, Zainab.
Sure, please do.
Originally, when the numbers were being reported, the state labs or the CDC or the national labs or the national lab testing companies, they weren't breaking things down by racial or ethnicity or anything else. So there's been a switch now. What we did is we took all of our cases. We were able to match the people's name for people who had in our state health database, and we were able to extract some of the data out that way as far as breaking it down. And then there's been a national shift to where everybody is now reporting off of a death certificate, which will do a couple of things. It'll provide the ethnicity, the age, and then also on the death certificate, it'll be verified if it was from COVID-19 or if there was other factors that were involved with it. And it's getting broken down that way. So the data is getting better. Everybody's very conscious of it, and everybody from the county levels to the state level to the federal level is really starting to want to make sure that we get the data right, and want to make sure that we address address it properly.
Excellent. And we also wanted to talk a little about like the testing piece as well. So Mr. McAdams, we had talked earlier about how the state of Maryland was working to expand testing around the state. And we wanted to allow individuals who either were presenting with symptoms or who were concerned that they had been exposed have that opportunity to get tested. Can you talk a little bit about the government's role in expanding these testing sites, and what have you been observing in terms of whether individuals have been able to access these?
Yeah, the testing issue is the number one issue, not only in our state as far as getting the test kits, but also around the country and around the world. There's currently over 185 countries that have been affected by it. So you have everybody fighting basically to buy the same products from the same one or two countries and the two or three or four manufacturers that put that on the market. So the key to moving forward is testing. You're seeing all different types of tests come in play and being tested right now, and it's greatly getting ramped up. I can tell you that the governor has a news conference today at 2, where he's going to be making a major announcement on testing. We believe that we're going to be in position to be able to do up to 10,000 tests a day, and we're working towards that right now. Currently, testing has been restricted to those who have very major signs or qualifying in order to get testing. And so it hasn't been on a vast populace where we can test the most amount of people. It's just been really focused on those who have had the symptoms. And the key in everybody's opinion is that testing is the key thing that needs to roll out in order to be able to kind of open the economy back up and make sure that we're doing good. And I do believe as we move forward over the next 60 or 90 or 120 days, you're going to see a lot more product come on the market, especially as these manufacturers are geared up and they're starting mass production. But the problem was it's just everything hit all at once, and everybody was competing for the same either PPE or the test kits.
So aside from, sorry,
Okay.
So
aside
Zainab, can I
from,
jump in on this point, just in terms of testing to, if it's okay,
Sure, please do.
just to support what Steve has said. And I think it's very important for people to understand that the fundamental rationale for opening up, even in the plan released by the federal government, rests on knowing that you have either a plateau or a reduction in both cases as well as influenza-like illnesses, and in doing massive surveillance. Unfortunately, that has been at least framed as a state responsibility right now. And so Governor Hogan has been one of the governors who's been really upfront about this. And I'm really excited, as Steve just mentioned, of an upcoming announcement at 2 p.m., Steve. This is really exciting for us because in this country, on the average, it is being said there are about 150,000 tests being performed every day. And the recent estimates out of Harvard University indicated that we need over 500,000 tests a day at the minimum. And so states are competing against each other. States are competing with other countries, and they are going out in the open market. They're trying to get tests from all around the world, not just in this country, but sourcing it from countries, including China. And so this is foundational to any discussion of opening up. And I think that if our own state, Maryland, is heading in that direction, this is really, really heartwarming.
Yeah, we have, he has a big announcement at 2. I'd love to share it, but it's, you know, I think it'll be a good announcement. But
looking forward to that announcement.
Yeah, so we really appreciate, and the state has put out a call to vendors, and we've been getting all types of great, you know, great ways, different ways that you can test, and we're sourcing all those now, and we feel that we'll be in a good position as we move forward.
So aside from just the testing piece, right? Obviously that's a huge issue. But what are some other challenges that you've faced from a, you know, a community standpoint, and then for Dr. Hyder from a scientific standpoint with the disease?
I can answer the first part real quick for Dr. Hyder, but really the biggest thing with testing has been twofold. One, getting the product to do the test, and then the second part was get enough labs up and running where they had some type of uniform test that everybody could get their labs going, and we could do mass quantity. But outside of that, the second part that's been extremely tough is the same thing with the PPE. Everybody all at once is sourcing PPE. We're competing with same, you know, all the same buyers, different countries. And the third thing that really seemed to be urgent call, which we've been working on, is the food banks. They are feeding, we were speaking with the Anne Arundel Food Bank, and we've been helping them source food. And they were telling us a couple of weeks ago, before even more people were laid off, that they were feeding in 1 week what they would normally do in a month. And so that demand has grown even more. Same thing with the Maryland and the Capital Food Bank. And we're going to be working on calls for donations to the food banks.
That's such a critical point, Dr. Hyder, before you get to that question, because we actually have been, meaning CAIR and other Muslim organizations who provide services to the community, have been getting requests for donations, in-kind donations, or non-perishable food items and things like that. And so as we get further into the webinar, one of the questions that I want to pose is, how can our communities step up and help other communities who are in need? Because right now, Ramadan is approaching. And one of the key aspects of Ramadan is charity and giving back to our community. And so many Muslims around the state are going to be very interested in finding out how we can support and uplift some of the hardest hit communities, whether it be in Rockville or Baltimore or Prince George's County or where have you. So Dr. Hyder, did you want to maybe touch on the second part of that question that Iman asked?
Sure. And I think that, let me try and respond in the following way, Iman. That's a great question. I think the social and societal challenges are actually greater than the technical scientific ones. And I'll explain that in 1 second. First, of course, this is a pandemic. It's affecting over 180 countries. Science is still catching up. We are still trying to figure out how to diagnose the disease. And Steve would know that over 90 antibody tests are out there. Only 5 have actually been approved thus far under the Emergency Approval Act by FDA. And so there's a lot of concern about science catching up to this disease in terms of treatment. Treatments are being explored, clinical trials are underway, but science needs time. It needs appropriate methodology. The part that I'm really concerned about is misinformation. And misinformation is really important for us, from community WhatsApp groups and Facebooks indicating that bleach can help you, that gargling with certain things will help you, older drugs can help you, various concoctions can help protect you. All of this is incredibly important for us to understand. These are not backed by science. There is no evidence for their efficacy. And so I think it's partly our responsibility to ensure that we debunk these types of myths, all the way from thinking that this is something that the world has experienced to conspiracy theories, etc. I think it's really important as a political community, but also as a scientific community, for us to push forward with essential public health prevention measures. Social distancing, staying away from mass gatherings, making sure that we look at our lockdown as a mechanism of saving ourselves. And in all societies, in all religions, human life is of primary value. And everything else is in order to protect human life. And so while I completely understand the desire to open up the economy and to go back to work, it is incredibly important for us to understand that that itself can create more cases and more deaths in the future. And so I think for science, this issue is really important. This is a pandemic where science should lead, not politics. And we hope that our leaders will listen more to scientists and physicians and nurses rather than to pundit makers and myth generators.
Absolutely. When we talk about the plans to reopen Maryland, Mr. McAdams, we talked about this very briefly earlier, and I know that there's only so much that you can share with our viewers up until official announcements are made. But the point that was made about testing and the fact that right now we don't have a cure, we don't have a vaccine, how is the governor's office handling this pressure from protesters? I know from what I understand, even today protesters are going to be descending on Annapolis. Many of these protesters are not wearing face masks. They are jeopardizing not only each other's health and safety, but also frontline workers, including police officers and law enforcement agencies who are there to help keep the peace. How is the governor's office responding to this pressure? And can you tell us anything about what the plans are to reopen Maryland?
Yes, absolutely. First, the governor would like everybody to know that he absolutely respects people's right to assemble and protest and let their voice be heard. You know, whatever you do, this situation right here is, there's no good choice that you can make. If you make a choice to lock down the economy and get people to stay home, then there's going to be all kinds of other issues that are going to arrive from it economically. People aren't going to the doctor right now. People aren't getting surgeries. It's crushing states and counties and federal budget, which will be issues that will have to be dealt with in the future. None of the counties or the state can spend any more money than what they actually receive in. So that means there's going to have to be some hard cuts, which is going to affect people as well. So it's a real balancing act, and you want to make sure you protect public health is the decision. The main decision here is protect public health given the situation we have. And even if you look at the president's plan, which was my opinion, I'm not a doctor, but I thought it was a pretty well thought out plan as far as when you can go into phase one, you have the steady declining over 14 days and everything else. But in general, the governor has said that we need 4 things in place in order to start moving forward and reopen the economy. The first thing is testing. We have to be able to have widespread and be able to do more testing. The testing is going to come online. It's just a matter of how fast this all the product's going to get ramped up. And as the doctor said, science takes time. So that will be coming. The second thing that we plan for is the hospital surge. On any given day, in a normal day, the average bed capacity across the state is about 1,000 beds. And a small percentage of that, maybe 15%, would be ICU beds, 15 to 20%. We were assuming with the models, and we're building out, that we'll be able to handle up to 6,000 beds and a very high number of ICU beds. Currently, we're probably about 4,500. Part of that is that the hospital systems now, Prince George's County, Montgomery County hospitals are getting pushed to the limit. That's where the majority of the cases are. The other hospitals around the state, we're probably about 50% down. So we have those, plus we have the ones that we're opening up with Laurel Hospital. We're opening up with the hospital in Tacoma Park. We're opening up, rebuilding up in Hagerstown. We opened up the Baltimore Convention Center. We're putting up the hospital tents from the Army Corps of Engineers around the state. And right now we're pretty close, and we're ahead of schedule as far as where we are with meeting that. The third component was the availability of PPE products. We believe that we're going to be in good shape on that probably in about 60 days, as all these manufacturers, not only within the United States, but are manufacturers here in Maryland, and plus a product that's coming in from the supply chain from the 2 or 3 countries that are predominant in providing that. And then the last part of that component, which we're working with not in the state level, but we're working with all the county health directors for each county or city around the state for the robust contract tracing. So we were ramping up from about 200 contract tracers around the state that would ordinarily be in place to work on any number of other health issues to being up to 1,000 contract tracers. So we're working on that. We're working with every week we have a call with county executives, and we have a call with all the mayors in 150 some cities around the state, and we're all working together to help build that out. And we feel that we'll be in good position on that as well.
We cannot thank you and the governor and his administration enough for the incredible work that is going into putting all of this together and putting all the resources and infrastructure in place to be able to get us to a space where we can actually have these conversations about reopening. And I think a lot of times when people become frustrated by the status quo, the social distancing, the self-quarantining, they're not acknowledging and taking into account the incredible challenges that are involved in making sure that the state government can do this in a way that is safe and that is constructive and that actually doesn't lead us down a path that can prematurely, God forbid, lead to more infections and more cases. To that point, Dr. Hyder, one of the questions that we had was about this second wave of cases that are being reported in countries around the world. And with pandemics previously, we've seen that when there is an outbreak, the initial wave will subside or ease off a little bit. Business goes back to a little bit like back to normal, life returns to usual. Then there's a second wave, then sometimes there's a third wave. What can you tell us in terms of like what we can expect on a statewide level and maybe possibly even on a national level in terms of these second waves and how possibly state governments and state agencies can respond to help kind of address this issue?
Thank you, Zena. First of all, I want to fully support the 4-point plan that Steve has enunciated for Maryland. That's exactly what scientists and researchers like myself have been promoting. I think the testing phase, the PPE, getting our hospital capacities up and running, and very importantly, contact tracing. And Steve, I'm very proud that the Milken Institute School of Public Health at George Washington University this morning was training 23 faculty and staff to help Prince George's County. It has already sent 15 volunteers to Montgomery County, and we are in discussions with other counties in Maryland to provide volunteers and support, particularly for contact tracing. You know, that's very, very painful work, but it's critically important work to figure out how each case, how each individual case, how many people they were in touch with, and getting them both organized and aware. So I think that plan is right on the mark. Zainab, I think that if the plan is put forth as Steve has just said, if Maryland follows the scientific protocol of ensuring that there have been the 2-week time periods, then I think even though the risk of a second wave always remains, because there are always some breakage and barriers in the population, groups of individuals who may not follow everything according to plan. And we are seeing in Singapore, for example, this particular pandemic to have a second wave. Unfortunately, there's our best shot is actually to do it well the first time. If you do it well the first time, then both the risk and the quantum of the second wave, it will be far less. What we are also dealing with is uncertainty. And this is because we haven't worked on this virus before, although there have been many other coronaviruses. This particular version of the coronavirus isn't there. Scientists, my colleagues who work with the immunological, biological aspects of this particular coronavirus, aren't sure about things like mutations. How will it behave? They aren't even sure right now about our capacity to develop immunity. As you know, some of the tests out in the market are testing for antibodies, both IgM and IgG. And in fact, some companies are purporting that they can tell you whether you are protected. Unfortunately, the evidence is still out. The studies are not demonstrating to this point. They're still out there. We need better understanding of whether when people develop antibodies, are they actually and truly protected? And then for how long are they going to remain protected? So there's a lot of uncertainty here. So in this situation of uncertainty, our best bet is to follow existing science, to try and do whatever we can in the first phase, and to again reiterate what Steve said, support public health infrastructure. It is incredibly important to support our county and our state public health departments, both in terms of human beings, in terms of equipment, and in terms of the funding that they need to support this pandemic care.
Dr. Hyder, thank you so much. We actually have a question from one of our attendees. They're asking, how do we measure the success of whether we've done it well the first time, like for the first wave? Are there specific metrics that we can take into account?
So first of all, I think if you look at even the federal government's plan, this idea of reducing the number of cases, which is directly linked with your ability to test, of course, reducing the numbers of deaths, which is directly linked to your ability to provide care to all those who need, and having the right equipment, including ventilators and respiratory support mechanisms. And then very importantly, to understand how the virus is spreading in the community. And that is fundamental to this notion of mass testing. We need to know how many people are asymptomatic carriers. So for example, if half of us have been infected by the virus, we can actually transmit this. And we can transmit the virus through droplet and aerosol, as well as contact surfacing. And even though healthy individuals have been affected and severely ill, the risk of becoming more severely ill is higher if you have comorbid conditions, if you are older, if you have other diseases which may cause further problems with it. And so it's not just a threat to us. You do these things to protect your loved ones and your community around you. So I want the community to really understand this. Your actions is not just for yourself. It is community service in its best form, which I think, Zainab, you were highlighting in the Holy Month is going to become increasingly more important for us to do.
Yeah,
absolutely.
And, we're really concerned about the elderly community, especially those in nursing homes or assisted living. That community has been disproportionately hit hard, and they're very vulnerable. So, very good point.
And I think that point, and I believe, Steve, a couple of our nursing homes have been very severely affected, but appropriate, obviously, safeguards are being kept. I think that it is incredibly important, again, to have those testing out there and to look particularly at symptoms. This virus, one of the other things that has taught my colleagues who are out on the front lines of clinical care is the diversity of symptoms with which coronavirus presents itself. I mean, classically, we are talking about fever, cough, and difficulty in breathing. But as you know, people are presenting with loss of smell, loss of digestive symptoms. I recently heard of a case that presented as heart failure. And so I think we are actually challenged in many ways. So in some ways, anyone who is presenting with unexplained or a classical symptom should be considered COVID unless proven otherwise.
Sure. Mr. McAdams, to the point of flattening the curve in Maryland, one of the questions that comes up frequently in the conversations that we're having with community members and community leaders is, are we at that place yet? Are we still climbing up that peak, or have we reached the peak, or what can you tell us in terms of like how effective the social distancing and self-quarantining is when it comes to flattening the curve?
Well, there's absolutely no question that we believe that the social distancing has had a major effect. Unfortunately, the numbers are still going up. The numbers of deaths are still climbing. One thing that the governor would like the community to shift their focus from a metrics is as we get more ability and we're adding more ability every day to test, the numbers are going to go up. But the really key metric to watch is the number of people that are going to be in the hospital and the number of people who are going to be, who pass away, on a daily basis from those numbers. So the hospital, watching the hospital number, those hospitalized, and then watching those the death rate every day is going to be really the key metrics, because as the testing goes out, the numbers are going to really, as our ability gets to scale, those numbers are going to really go up. So those are the two key factors to watch.
To that point, what can organizations and individuals do in our personal capacity, in our organizational capacity, to support the very critical work that the governor's office is doing, that you're doing, to help flatten that curve and to help get food and resources, critical resources, to the communities that are hardest hit? How can we support that work?
So on Friday, the governor issued or gave $4 million additional to the food banks, the Maryland Food Bank and the Capital Region, and each one of the counties matched that. So it was a total of $8 million. So that will help us a little bit in the short term. But we are working with both the Maryland Food Bank and Orlando Food Bank and Capital Region Food Bank, where we're going to work with them if they need to have calls to the community for either donations of food, or if it would be more effective if it was donations of cash, money, in order to help them do that. So we'll be working with you as we move forward over the next week or so. Once they understand the best way and the most effective way to be able to source the right food and healthy meals, and be able to get them not only procured, but also be able to execute and get them out to the food pantries. So there will most likely be a call coming for that, and we just want to make sure we understand what that is and the best way that they can execute on getting people the food.
Please keep us posted, because CAIR has also received numerous inquiries, because as Ramadan is approaching literally right around the corner, a few days off, many organizations and community members are trying to find out how we can support those who are the most in need. And so being able to harness like that potential to really kind of alleviate some of the suffering and some of the need in our communities, I think inshallah will be really, God willing, will be like a really powerful way that we can help support not only the governor's office and the work that you guys are doing, but also the communities who are struggling in these really dark times. Dr. Hyder, to that point, can you provide some inspiration or some guidance for Muslim communities as we enter into Ramadan? This is going to be the first Ramadan of its kind where we are socially distancing from one another and kind of really, really being forced to stay away from mosques, which centrally have been kind of the hub where a lot of the activity occurs during Ramadan. And can you also help kind of reemphasize the point of what social distancing means during this month?
Well, thank you, Zainab. First, I want to make clear that I'm not a religious scholar or a theology professor, right? I'm a professor of public health. And so my perspective comes from public health. I think that Ramadan does not mean that the virus is not active. The virus has not decided that during the 30 days of Ramadan, it's somehow not going to be infecting each other. So everything that you were doing pre-Ramadan, you must maintain during Ramadan as well, which means that social distancing must be maintained, that congregations are not allowed, and bypassing that, because our masajid are closed, trying to do alternative communal prayers in your homes or your basements is ill-advised. It is incredibly important to understand that these rules are meant to prevent the transmission of the virus and to protect us. Islam, like all other religions, gives primacy of life and health to everything else. And so what I'm going to say, Zainab, is that this is an incredible opportunity for us for self-reflection, to spend time thinking about your own actions, your own behaviors, your own situation, to spend time with your immediate family, those who are in your house, and to use that time as an opportunity to really reflect on one's behavior, on one's tasks, on one's calling in life. Second, it's a huge time for opportunity to help those who are less fortunate. And through the governor's office, through CAIR, and through various other organizations that are supporting our local communities, it is incredibly important to channel that energy and devote it to others. By staying home, by wearing your masks, by ensuring that you only go out if it is absolutely essential. I've been following various models. These are epidemiological models. And one of the more famous ones comes out from Seattle, from the University of Washington. And according to the version that they put out day before yesterday, it'll be way into June before, and if we are lucky, thanks to the work of all of us, where maybe there can be some relaxation for social distancing. Now, these models, of course, have many, many assumptions. But what this means is this is not something for a few days. We have to make sure that we go through Ramadan, and then also Eid celebrations will have to be done more at the individual and nuclear family level. And I think there's absolutely nothing wrong with that. I think it's a huge chance for us to connect with those who are immediately around us and to serve others by doing the right thing.
It's such an important point. One of my friends was actually saying that this is a Ramadan of socially distancing ourselves, but also spiritually reconnecting with our Creator on an individual, one-on-one level. So thank you so much for sharing those thoughts, Dr. Hyder, and Mr. McAdams. Thank you so much as well. Mr. McAdams, what is one example or some positive stories that you've seen? We've talked a lot about, the challenges and like some of the pitfalls of this pandemic and how it's adversely impacting our communities and the state and entire country. What are some positive stories that you've seen of Marylanders stepping up, possibly, or organizations or individuals going above and beyond to support one another?
Our office is overseeing the governor's Maryland Unites website, which is sourcing donations and Red Cross, Meals on Wheels, and also the food bank. And I can tell you that the spirit across Maryland, from corporations to nonprofits to individuals, is tremendous. The energy and desire to help is like nothing we've ever seen before. We've had Mount Air Chicken, which is one of the largest chicken distributors in the nation, the 7th largest. They've delivered truckloads and truckloads of frozen chickens around the state to Maryland Food Bank, Anne Arundel Food Bank, Capital Food Bank, to Salisbury. They put a tractor trailer out and gave every employee at Salisbury Hospital, Peninsula Regional Hospital. We have companies like Maryland Packaging, who converted it, and they're making hand sanitizer. They gave out $100,000 worth of sanitizer, and they gave 50,000 packets of hand sanitizer to living classrooms to distribute in Baltimore City with meals and care packets so that people could use that. We've had Hunter Douglas, who has a factory in Cumberland that they make blinds, have a factory there. They just donated 10,000 surgical masks to the local health department, which in Allegheny County, which they're giving that out. So, we could go story after story. We have a paint company in Pasadena 3 weeks ago. They gave 14,000 N95 masks to the hospital system here. And it's unbelievable. And the individual stories of how people are helping, caring for elderly, buying meals, driving meals around. It's just, it's very inspiring, very inspiring.
For sure. I want to get to this audience question real quick. So if you are an asymptomatic carrier, are you in that state for a certain number of days? And then do you have the antibodies, or, just what does asymptomatic mean exactly when we're talking about the virus?
Yeah, so Iman, asymptomatic means without symptoms, which means that you are not exhibiting fever, you're not coughing, you don't have breathing problems. And the only way to figure out that you have the virus is to get tested. And that is the fundamental concern around massive testing. and then you are infective for a certain part of that duration. And the periods of infectivity, according to the studies that have been done, have ranged from 3 to 14 days. There are some reports of even 21 days of infectivity, but in general, that's the time period, which is why in many public messaging, the 14-day quarantining, the 14-day period has been used. So it's a state which is really difficult to understand because you don't have symptoms, you don't know if you are, and only when we start testing massively at a population level will that be actually known.
Thank you so much for answering that. And Mr. McAdams, back to your inspirational stories that you've shared. I mean, I think it's absolutely incredible to see the way that our shared humanity is emphasized and reinforced in these times, in these dark times. And, it sounds trite, it sounds cliched, but we truly are in this together. And when we see communities and organizations and nonprofit entities like step up and really, come forward and find and figure out ways that they can give back, whichever way they can, I think it really sort of diminishes some of the pain and suffering that many communities are experiencing. So thank you so much for sharing those powerful stories of ways that ordinary people are stepping up. I know this is something that has impacted every single one of us, and especially people like yourselves who are on the front lines in many different ways, who are trying to find solutions and not sleeping much. I know you haven't been sleeping much these days, trying to just manage all the different pieces that go into logistically executing some of the solutions that your office is coming up with. Is really inspirational. If you had advice for those who are struggling in these times, and this is to both you, Dr. Hyder, and to yourself, Mr. McAdams, if you had advice to those who are struggling in these times, whether it's because they've lost a loved one that they haven't been able to mourn properly, whether it's because people suffer from mental health crises or issues that they're not able to get assistance for, whether it's because there's so much darkness and heaviness, what message do you have to those who are trying to find a positive light in these dark times?
If you want to go first, Doctor, or I can.
Go ahead, please.
Okay. Well, the message that the governor would like everybody to know is that every level of government, whether it's an elected official on the county council, to the county executives, to the mayors, to the governor, to the vice president and the president, everybody is communicating throughout the chain almost on a daily basis. And we want you to know that we understand and we hear the pain that you're going through, but we will get through it. It's important that you keep communicating with us and let us know where you're at, what your issues are, so that as each level of government works on, as we come out of this phase and we go into stabilizing, and then as we go into recovery, each phase we're going to be addressing different issues and have different solutions to help people out. So let them know that every one of those elected officials are very worried. They're all working together seamlessly. They're communicating well, and we want to keep hearing from you so that we know as we go through each different stage that we'll understand how best to try and serve and help you recover.
No, thank you. I concur, and maybe I'll just say three things. And one is that acknowledge the difficulty, right? So we all have to acknowledge these are tough times, whether you are living in a house with a yard, or you're living in a one bedroom, or you're renting somewhere. These are very, very difficult times. So let's acknowledge the challenges. But second, get help, seek help, communicate. This is really important because you're not alone. You're absolutely not alone in struggling through this. And whether it means talking to your friends, to your family, to the community, or reaching out to the governor's office or to organizations like CAIR to let them know what your struggle is. Maybe they'll be able to help. Maybe they'll be able to talk to you. And third is really to find your inner resilience. We as a community are very resilient. This is not the first time that this community in Maryland or Baltimore City or the Muslim community has faced threats like this. We have an inner power amongst us. And so in addition to seeking external help, this is your time to reach deep inside yourselves and find that resilience, that core, which will hopefully stabilize you and help others around you.
Powerful, powerful, powerful words of advice and inspiration. We thank both of you so much for taking time out of your very busy schedules to be here with us to share your expertise, your insight, your guidance, your words of support and resilience. We pray that this passes quickly and that with as little harm as possible. And just know that you, especially Governor Hogan, Steve, please communicate our regards to him. Please let him know that he's in our prayers. The entire administration is in our prayers as they work to move forward and find a path forward for our state with as little damage as possible. And that we're here to also support you and uplift the work that's being done so that our communities can get through this together. Thank you both again, and we will get through this together.
Yes.
Thank you very much.
Thank you, Zainab. We really appreciate that. And one other point that the governor would like to make is that we are probably in a period of change where there's going to be new opportunities for discovery, products, innovation. And while sometimes we may get focused on the way things were, take a step back now and think about the problems that are before you. And if you can come up with a solution, because there's going to be a whole new economy most likely born out of this, and lots of opportunity, and it's time to change. So, and the other thing, as you deal with different communities around the state, just remember each day that this goes on, it's going to create a greater magnitude on pressures on people. Some folks may not have enough savings to ride it out, and they're feeling the pressure. Where am I going to support my family, keep my house, everything else? And the governor understands that, and we're going to do the best that we can. Thank you.
Thank you so much.
Thank you guys so much. We appreciate you taking, as she said, the time out of your schedule to come and talk to us about this.
Thank you.
God bless you.
Thank you,
Take care.
Doctor.
Bye.